Okay, guys, sorry I'm a little late. I've actually had a few errors with this. Um, we need to just start here at the thoracic cage, and then we will be going on and finishing with the arm and leg. I'm not going to spend a lot of time, but you can stop the notes and finish filling in things as you go along, because most of the stuff is things that we've gone over in lecture, and quite honestly, it's pretty boring. So, sorry I didn't get this to you yesterday. That's my fault. All right, the sternum. You should have noticed in lab that the manubrium is that small portion of the sternum at the top where the clavicles are attached to. The body makes up the most of it, and then the xiphoid process is the small piece of cartilage hanging at the end. You should have named or numbered and counted how many of the true and false and floating ribs there were. So the first 7 pair are directly attached by their own cartilage to the sternum. The false ribs are attached only via an extra piece of cartilage that goes up to the true ribs, and then the floating ribs are not attached to the sternum at all. All of these are flat bones, the ribs and the sternum. The pectoral girdle, think of pectoral muscles, is what attaches your arm onto the sternum via the clavicle. So it consists of the scapula and the clavicle. You can see there in yellow. This is a pretty movable joint, the most movement that you can have. We're going to talk about movements in chapter 8 tomorrow, but makes it a little bit at risk for dislocation. So very flexible, and yet more at risk than the hip is for dislocating it and injuring those things, because really the only thing holding this together is going to be tendons and ligaments and muscles that cross that joint. Now this clavicle, you'll notice, has acromial extremity and sternal extremity. We're going to call those the sternal and acromial ends of the clavicle that you looked at in lab. And again, it's curved to the front so that if it breaks, it does go out rather than back in. The subclavian vein underneath of this is very large. If you were to rupture it, a person could bleed to death fairly quickly, and it would be very difficult for you to stop the bleeding because it would be internal. Many points that you named on the scapula, scapulae with an E on the end is plural, by the way. All of those projections are for muscles to attach to. It really just sits on top of the ribs and above the muscles of the ribs and of some of the back, and then many of those muscles also attach. Okay, you can pause this real quickly here and answer this question, and then I'll give you the answer. Okay, high degree of flexibility, low level of stability. Number 2. These are all things that we looked at in lab, attachments of muscles and so on. You should have answered the question, the ulnar nerve, when you bump the medial side of your elbow, sometimes you'll hit this ulnar nerve, which runs right along that epicondyle. And we call that the funny bone, but it's really not a bone at all. It's a nerve, but it gives you that tingling sensation that you feel. I talked to my lab about the olecranon and coronoid fossas, or the olecranon fossa. The olecranon fossa helps you to remember which is the posterior side of this bone. Both of these articulate with the ulna. So you've got the coronoid process and the olecranon process of the ulna, and they fit into these two concave spaces on this bone. So they're called, have the same name, but with fossa behind it instead of process. Okay, you might want to pause this here. You can write down anything that you need to on this one. These are some good pictures that I found on the internet. I know when you're studying, you use your book, but you could also maybe find some other pictures to help you studying, but make sure that you get into the lab and study the real bones as well. So you might want to pause this and fill in those notes. Okay, the wrist bones, there are 8 of these. I would, to remember these, come up with some mnemonic device. For instance, start with the C of capitate or the H of hamate, go clockwise around these bones, and come up with some mnemonic device using the first letter of each of those bones to help you remember those. The tough part is you've got 3 words there that start with TR, so that makes it a little bit difficult, and you'll have to remember those. But I probably will ask you 1, maybe 2 of those on a lab practical. just so you don't get too stressed out about it. Okay, carpal tunnel is a really common thing these days because people type on the computer a lot. People like dental hygienists that use really repetitive motion of their hand get this a lot. It's because there's inflammation that causes swelling of the tendons in this part of the hand, and that will then impinge on the median nerve, and that nerve goes to the thumb and the first 3 fingers. Notice that it doesn't affect the pinky or the lateral side of your ring finger because that nerve doesn't serve those. And there are many, many people these days that get surgery to relieve that pressure so that they can have more comfort and get rid of that pain. Metacarpals are all the pink ones. Phalanges are the fingers, and note that the thumb, which is sometimes called the pollicis, we'll come back to that when we get to muscles, only has 2 phalanges, the proximal and distal, and all of the other fingers have a middle phalange, which is purple. And the legs are going to attach to the axial skeleton via the coxal bones. And this really formed from 3 bones that fuse together. You cannot see where those fusion points are like you can in the skull. But everything that's yellow there is the ilium. That's the biggest part. When you put your hands on your hips, you're putting them on your iliac crests. And then if you're relatively thin, you might be able to feel that anterior superior iliac spine at the front. Just below the greater sciatic notch is where the actual division is between the ilium and the ischium. And so the ischium is in purple there. You sit on your ischial tuberosity. That's down at the very base of that ischium. And then the red bone is the pubis. Okay, so these 3 colored areas are all part of the ischium. Ischial spine is yellow. The ischial tuberosity is the green. And then you can see just below the greater sciatic notch the ischial spine. So that's where you know that the ischium actually begins. The pubis is red again in this picture, and it's held together by the pubic symphysis. That can get torn sometimes in accidents or in the birth process. That's very painful, and it also takes quite a while, many weeks to heal, because this is fibrocartilage and it doesn't have very much blood flow to it. If someone finds a skeleton and is trained to know what to look for, they can tell if it's a male or female because of the angle and the pubic arch of the skeleton. They can tell if it's male or female. Okay, this is a cool bone. Many of you pointed that out in lab as well. You could really use this for a tool, a weapon to protect yourself with, because it's so big and so strong. It makes up 1/4 of your height. And again, if somebody finds a skeleton, they can tell approximately the height of the person by this bone. At the fovea capitis is where the ligamentum teres attaches. It's not super strong, but it does help to hold the femur head into the acetabulum. All the bumps and ridges, trochanters, linea aspera, that's for all of your hamstring and gluteal muscles, and biceps, triceps, so on to attach to. Okay, I'm not going to talk a lot about these. You can stop it here and fill in your notes a little bit on the tibia and the fibula. Okay, and then note on the foot that the tibia sits down on the talus. You know, it's that smooth surface on the talus where the tibia sits down on, and it's one of the ankle bones. These are short bones. All of these are short bones. I only had one out in lab, but they're all classified as short bones. And the Achilles tendon attaches to the calcaneal bone, so it's really called the calcaneal tendon. It attaches the gastrocnemius and soleus muscles from your calf down to your ankle. Everything that's pink is metatarsals, and then phalanges again with the hallux or the big toe only having 2 of those phalanges. There's a pretty good picture in your book of the arches of the foot that I didn't include here because I didn't have quite enough space for that, but you can look at the arches. Okay, I'm going to leave you 2 questions here. You can stop it, pause it for a second on each of them, and then I'll tell you the answer. Okay, these really are called coxal bones, formed of ilium, ischium, and pubis, so that's 3 bones that make up each coxal bone. Okay, which of these bones doesn't bear any of your weight? The fibula is there only for muscle attachments. The tibia takes all of your weight down to your talus of your ankle. Okay, we're going to start with Chapter 8 tomorrow. Now we got through the boring stuff. So, sorry I'm late again on this. I will see you tomorrow.